Hi folks, Dr. Byer. Today we're talking about autoimmune disease, and it's one of those things. Autoimmune disease means that where your white blood cells or your immune system is mistakenly attacking your own tissue, and that can happen in various tissue sites. And the thing that as from someone who practices functional medicine, we want to know, why would your immune system do this? What is triggering your immune system to attack self? And one of the biggest things are hidden infections, whether it be in the gut, whether it be dental infections, whether it be chronic viruses and things like that, Lyme disease. Most of our autoimmune patients come in, they have some sort of infection, but the most prevalent place is in the gut. Now you have to realize that 80% of our white blood cells, which are what our immune system is, reside in our gastrointestinal system. So it's very common that this is a spot for infection because we are constantly eating germs every day. If our stomach acids are appropriate, if our saliva is appropriate, if we chew well enough, and our gut is working right, and we have proper gut flora, these germs usually aren't able to thrive, but in many of us they do. And so many of our patients have these hidden gut infections and they don't know it, and we have to eradicate these infections, which can be done very effectively with natural botanicals, antimicrobial botanicals, even better than antibiotics. So we see things like yeast overgrowths, bacterial infections, even parasites. I had a patient the other day with all three. And so this is a huge trigger to autoimmune disease. It's in the scientific literature. And most traditional medicine doesn't even check for these things. So we have to identify this. Now, the other thing that I want you to know is there's a lot of bad stool tests out there. Most of them are. You need to have a lab that will check the stool more than just one day. And you also need them to have it look at it microscopically, and also to be able to grow it out in a petri dish and see if there's any overgrowth or germs in the stool. So once we identify these in our autoimmune patients and we get rid of them, that's just one of the big reasons why a lot of our autoimmune patients get their lives back. So I'm Dr. Byer. Hope that helps. Have a great day.